Awesome. All right, so we are going to call tonight's Board of Health meeting to order. The Board of Health is recording. Is anyone else recording? Okay, and we are hosting tonight's meeting virtually via Zoom webinar pursuant to Governor Baker's March 2020 orders suspending certain provisions of the open meeting law, which has now been extended, correct, through December, I believe. March, even better. Awesome. So the first thing on the agenda for this evening is the minutes from the last meeting. So Renee, thank you so much for sending those over. Does anyone have any corrections or changes to the meeting from June 30th? Nope. All right. If they are okay as written, can we get a motion to approve the minutes as written?
I motion to approve the minutes.
All right. Great. I can second that. And we'll do a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
And Rebecca Torsha?
Aye.
All right. Thank you so much. So is anyone here for public comment?
No.
All right, moving on then. If there's no public comment, the first thing on our business at hand is the tobacco sales regulation discussion. And Cheryl, we're very happy to welcome you to our meeting tonight.
Thanks for having me. It's amazing doing it virtually and not having to drive to East Long Meadow.
We would love you here though.
Oh, I like coming to East Long Meadow too. I'm not sure what you've already discussed. I've reviewed the regulation. I've reviewed your current regulation and the checklist that I believe Sarah worked on with, was it with Tammy?
Alex.
Yes, okay. So I'm not sure what you are interested in doing. Are you interested in updating it so that it matches the state law, basically? Because you have a very nice regulation. It's just not up to date with new definitions and taking out the exemption on flavored tobacco products for mint, menthol, and wintergreen, which now clearly with the state law is included. So, and I'm happy to put this together for you. What I can just, I'll just briefly go through your current regulation and what would need to be changed. And the first thing is in the definitions section. The state law updated certain definitions, and we have also recommended updating certain other regulations. For instance, one is the adult-only retail tobacco store. That definition needs to be updated so it's in compliance with the state. The blunt wrap definition, we have just, through lessons learned, added another sentence to it. Characterizing flavor, we just need to take out the exemption for menthol, mint, or wintergreen. We have a new definition for cigar. And then the rest of your definitions are great. One thing that I saw was missing, and I don't know if it's something you want to put in here or not, but prohibition of the sale of tobacco products in healthcare institutions like pharmacies. I don't know if you want to include that or not. That was just a question I had. The liquid tea nicotine container definition has been updated. And I don't need to go through all of the updates. I can just put them in a new draft for your review. Another piece that I'm not sure whether you're interested in looking at is regulating flavored rolling papers. It's something that you can do now. We used to be preempted from doing that, prevented from doing it because the state law did not allow us to. That's changed. That's a decision that the board can make. I can put it in and you can take it out, you know, or you can instruct me that you don't want it. The other question I had was on smoking bars, whether you wanted to address smoking bars or not. It's not in your It is there's a definition for it in your current regulation, but I don't think there's a part, it isn't addressed except in the definition section. So I don't know.
Long Meadow.
Excuse me?
They
I
aren't
don't know if
allowed.
you,
Yeah, it's
do
in
you
your
have any smoking bars?
No.
No.
Mm-mm. They're not, from what my understanding, they're either not allowed in our regulations or at least planning board, a zoning bylaw.
Okay, so we may want to just put in the new definition and then prohibit them.
Mhm.
Yeah,
Yeah.
definitely make it clear.
Yeah, yeah. Your flavor, you don't have a definition in here. Obviously, why would you? Because it wasn't in effect when these regs were done for a tobacco flavor enhancer product, which we want to include here. And then the whole section on tobacco sales to persons under the minimum legal sales age it has been changed by the state law. There are lots of new signage requirements. I will just plug that all in. There are some additions in the tobacco product sales permit section, which would require retailers to also possess and show the Department of Revenue licenses that they need to have in place. I am assuming, I'm not sure, but you have a cap now, a general cap of 18 tobacco product sales permits in East Long Meadow. I'm assuming you want to keep that. I don't know if you want to, if you've lost any stores or whatever. I was planning on just keeping it the way it is, if that's okay with you. And then the cigar sales regulated, I would just tweak some language to bring it up to what we currently have in our regulations. It actually makes it easier to read. And the price of $5 for a package of 2 or more, pursuant to the consumer price index, that's been raised to $5.80. So I can make those, minimal adjustments as well. And these are all just bringing you up to the state law. The biggest issue, well, it's not an issue, but the biggest decision that you want to make is that now that the state law has fines for the first offense of $1,000, the second $2,000, and the third $5,000, all within a 3-year period, those you have to incorporate into your regulation. You can't have less, you can't fine less than what the state is requiring. But that only applies to certain sections of the law. It applies to age 21. It applies to the signage that the state is requiring. It applies to the sale of flavored tobacco products. It would not apply, you would be able to leave your current fining structure of 100, 200, and 300 for those sections that are unique to this regulation, that are local. And those are the cigar packaging piece, the no sales in an educational institution, or a pharmacy, if you want to add that. And that's up to you, whether you want to have 2 separate fining structures, which we can do quite easily. Your capping would fit under that. The roll your own machines would fit under local law. No new tobacco retailer near schools, those kinds of things would be, you could use your 100, 200, 300, or you could make the whole regulation subject to the state fining structure. That's really up to you. And another important thing to remember is that the state law also requires a mandatory suspension for the first sale to someone under the age of 21. There's a mandatory suspension of 1 to 30 days, depends on what you want to do. What we're seeing most people do is to make it somewhere between 1 and 3, since the second offense for all other violations would be a 7-day suspension. So that's what most cities and towns are looking at, somewhere between 1 and 3. Since it is mandatory, you can't, clearly after hearing, but it's in the law. So that's one decision that, and you don't need to make it now, obviously, but the decision of whether to implement the state fine for all violations, or to have 2 separate tracks, one for the local sections and one for the state sections. So do you have any questions? You want me to I'm happy to just draft this and send it to you folks, and then you can review it. And I'll make it clear which are the state required new sections and which are the local. The state will be highlighted in yellow, your local will be in green, and I'll put in the dual capping structure for now, and then you can make a decision.
That sounds great.
Do you know
Okay.
which, Alex, do you know if we have any pharmacies that are selling tobacco?
No, they don't. Cheryl, I did have a question about the tolling
Sure.
period. In our regulations now for local violations, it's 24 months. So
Right.
is the minimum now 36 months?
The minimum is 36 months
Okay.
for all of the for the state law. It's
Okay.
a minimum of 36 months. I would suggest, because I think it would just be difficult to have 2 different tolling periods. I would just have it all at 36, just because it gets really complicated if you have 2 different tolling periods. Unlike 2 different fines, you can have the different fines, that's easy to capture, but the tolling periods are tough.
Mm-hmm.
Cheryl, thank you so much. Going
No
over
problem.
this
I'm
in
happy
so
to
much
draft
detail
it.
for us. And obviously we had the opportunity to look through some of this, or most of it, beforehand.
Good.
Katie or Rebecca, any questions?
I do think we should add the flavored tobacco wrappers regulation in. I think
The
just have
rolling
that-
papers, okay.
Yeah,
Yeah.
I think that would be good to have that in as well too. And everything else you said, we'll kind of just make those little tweaks when you send it to us with the options, but I think everything else looks great.
Okay.
If anyone
perfect.
wants to
Did I
send,
get them? Should
Oh,
I
I'm
send
sorry.
them to you, Tammy?
yeah, sure. I say if any of the board has notes that they want to send any
Please,
particular way, just send them.
just use my email address. You have that, so just, send me, if you think of something when I'm not on the call, in the meeting anymore, just let me know.
Fantastic.
Okay. Oh, one other thing, you ban self-serve, do you have any adult-only retail tobacco stores?
Yeah, we have 3.
Okay, so this has come up recently, and it's one of those lessons learned. Currently, your regulation bans self-service displays. Do you want to make an exemption for adult-only retail tobacco stores because no one under the age of 21 can enter? Right now, there is no exemption. You don't have to do it. We've just received calls from some municipalities that are saying, well, if no one under 21 can go in there, do we really care about enforcing that piece about self-service displays? I'll leave it out, and it's just something you can decide. It's just something that's come up recently.
I haven't been in any of those places. What are they like right now, Alex?
So one's at like C-Mart. C-Mart has 2 separate sections of their store. One side is you have to go, it's locked, you have to ask to go into it, and the other one is blue collar cigar. which is locked. I mean, they're all locked. Well, they're supposed to be locked, carded on. I mean, I guess I don't.
They're used to having this ban
Yeah.
in place, so
Yeah.
it's really a decision that you can make. I'm just letting you know what some municipalities are doing.
Yeah.
Okay.
Okay. Is that it?
Anything else new coming our ways as our representative for MAHB?
Anything new from us?
Yeah.
Yeah, actually, we are going to be holding another certificate program online, end of September, beginning of October, that for Board of Health members or staff that want to come. What we did this year with our program, which is different than what we've done in the past, is we've just held one track and we're staying in our lane. It's the whole program is on legal issues, on the open meeting law, the public records law, legal authority, how to conduct a productive Board of Health meeting. It was very well received. So we're doing that online for those that couldn't attend in person. We have someone from the AG's office who speaks, and then also an update on the public health excellence grants. So that's new. And I think the new things that are coming toward us now are, number one, monkeypox, number two, PFAS issues, climate change. These are things that we will be addressing. The other issue that I'm sure you're more than well aware of is just the funding that is going toward local boards of health. And the law that was passed by the legislature, the SAFE 2.0 that the governor sent back with amendments, that's still in play. But there's $500 million of ARPA funds that are going to support local boards of health over the next 5 years. And there's also a $15 million budget item in the budget for the Public Health Excellence Grant Program. So we're in a position that we've never been in before historically, in that we have a line item in the budget that's being funded substantially by the legislature. So I think that's going to really help us transform how local public health is delivered in Massachusetts. So hopefully everyone gets access to the same services. So I think those things are all really exciting that are happening now. And I'm glad that I'm here to see it. I won't see the whole transformation, I'm sure, but I'm glad to see that it's a priority with the legislature. So those are some of the things that are happening.
Fantastic. If any of the board members would like to sign up for the certificate program, just let us know and we'll go through the registration process for you guys.
I wish I had the bandwidth to do that right now. Unfortunately, I don't.
I know. You know, there's never a good time.
No, if you could at least send the information out to us, I think we'd appreciate
Sure.
it. Even if we
Yeah,
don't,
yeah.
can't manage it at this point.
And staff is invited too. We get a lot of health agents, health directors, and some public health nurses too. And we do give continuing education credits, CEUs.
Maybe I should email you directly, because I've been emailing the email on the website to register our.
The registration isn't up yet.
Oh, it's not. Okay.
No, it's not up yet.
Not for the certificate program, but for registration to have access to the materials on MAHB.
Oh, you should have that. Email me
Okay.
and I'll
Thank
take
you.
care of that. Okay,
Perfect.
email me.
Perfect. Thank you, Cheryl.
Okay, sure, anytime. Have a good rest of your meeting.
Thank you.
Cheryl,
Bye-bye.
thank you very much for joining us tonight.
Thank you. Bye-bye.
All right.
I think it was really helpful, Alex, that you made that the checklist with the, our 2018 versus the new stuff. That I think that like helped everything put it in perspective, since you're our tobacco guru.
Yeah, Yeah, if any of you have any opinions on the suspension length or the separate fines, just email Tammy and I about it. But
I have
think
opinions.
for like when I read through it, I just thought when I read it again, I've never read this before, but having us just in line with what the state's doing, and then what they recommended, I think that seems like appropriate too. So we can kind of see. I don't think we need to deviate or do anything different. It didn't seem like it was, it seemed pretty straightforward.
yep. Yeah, definitely.
And all the towns that you work with for the Tobacco Coalition, they're pretty much getting on board with these same sample regulations, right?
Yeah, right now I only know of one other town that bans the flavored rolling papers. We have to keep in mind too that there are other stores that sell those products that aren't tobacco stores. So it's just something to keep in mind. Because that does include like the hemp wraps, any rolling paper. So there are stores in town that sell those products. But I think most towns are going to get on board with that pretty soon because of the confusion about being a flavor enhancer versus, an actual rolling paper blunt wrap, which East Long Meadow has banned blunt wraps since 2018.
And Alex, do we currently have 18 licenses out there?
No, we have 16 right now.
Okay, so that's something we actually should have to discuss, is if we want to keep the cap at 16 or if we want to, or keep it at 18, or if we want to drop it to 16, given that there are current 16 active licensees,
Mm-hmm.
right?
Yep.
Because
Yeah.
there's the reducing cap option, which is that anytime we get reduced by one, we continue to lower the cap down.
Yeah.
16 is not a lot for a community our size, which is great that we're already at that.
Yeah.
Rebecca, are you sharing with us, or are you talking at your house because you're muted?
She was just saying, okay, I think.
Sorry. My son called me.
No worries. I can
So-
read lips.
Yeah, sorry. I was just, yeah, those things happen.
I just wanted to make sure we weren't missing something
No.
important that you wanted to
I just
share.
was trying to get off the phone with him. No
That's
problem.
okay.
Okay.
So if you guys want some time to like mull over that and think over it, then send them back to me. I don't know if we want to do anything official for the next meeting, or if we want another meeting to discuss and then we can post it and then go ahead and vote.
Can we have time to think it over? I'd like
Yeah.
to review and look it over before, because there's a lot of information there and
Let's move. So this is the end of August.
Mhm.
So maybe for October or November.
yeah. sure.
When do we have to
That's-
decide by? That was my question. Is there a deadline?
No.
Well, our tobacco permits,
Yeah.
they're every September, at the end of every September, which we do have to post a public hearing in order to pass new regulations. The reason what prompted this updating our sales regulation is that we had a sale to a minor, one of the stores, and the fact that, you do have to decide on that suspension period, which now that it's required for a sale to a minor. So, the sooner that we get it done, the better. But, because the Tobacco Coalition does 2 sales checks a year with minors, and then the FDA also does checks as well.
So with that being said, could we then get the information, I'm giving her like a week or 2 to update it. I don't know how fast she's going to be. I mean, she's doing this for the whole state, right? So if we get it, say mid-September, we can review it before the meeting, have discussion, and then do a special meeting where we do just the voting and do public hearing afterwards. Would that be okay? So then we could get it done at least by like October.
The other thing we could do in that same time frame is get it, review it, discuss at the next meeting, and just
Yeah.
post and vote in October without
Yeah,
having to
that-
host the
Yeah,
special
why don't we
meeting.
just, do something like that then?
Yeah.
But there's nothing changing on our permits that anybody wants, like the fees or anything like that. It just says that we have to, our old rules say we discuss them annually.
Yeah.
But that's-
And the fees that the state went up, we just have to match those, right? That's what I understood when she described that.
Yeah, like that's, even with what we have here, basically, we could charge $1,000 plus our fine says 100 for first. So it would be two separate fines in a way, but this way would kind of streamline it to
No,
one.
and I agree. If the state's going up on their fines, we don't need to change ours. Unless there's other things that we need to cover the expense of. If we have a fine that we have to put out, is there anything else additionally we have to cover? Okay.
I don't think so. I don't know.
No, it sounds like we only have a few decisions we need to make. One is that rolling paper that we were just discussing, right? And then one would be the length of the, my brain is not working. I'm sorry.
Instead of the 18, the 16.
Yeah, we could reduce to 16, and then the suspension period.
Yep.
We have to have a suspension, we just have to make a decision on how long that suspension would be.
Yeah. And how long was the person suspended that did violate? Right now?
We didn't have a hearing.
Wait, what?
We didn't have a hearing. We have to have a hearing.
Oh, you haven't had the hearing yet?
Oh,
Yeah, it's still in
I'm
the
like,
process.
Yeah, they were fined the $1,000 because it was their first offense, but we haven't had a hearing yet for them for the actual suspension.
I thought you meant that we were not suspended. I'm feeling like that's against the rules. All right, so then we're all in agreement then we'll next time.
Yep.
We'll review each for the next meeting, all the changes we get from the tobacco group, and then we'll be able to discuss them, and then we'll have another voting meeting the next one.
Sounds
Sounds
good.
like a good plan.
I love it.
All right. Is there any further discussion on the tobacco regulations at this point? Okay, then we are moving on to septic system permitting requirements and fee schedule. And I'm actually just really excited we're not talking about COVID all the time. So I was so excited to see like septic systems and tobacco regulations, Tammy. Like I can't tell you how excited I was to read tobacco regulations. So
We're happy
you.
that it's something different. Yeah.
There's life beyond COVID.
There certainly is. There certainly is. The things that I want to bring up is mostly it's really just to streamline what we do now. We do not do a lot of Title V permitting in East Longmeadow. It's very, I think so far in 2022, we might have had 2 perk tests on so it is few and far between. But the way that we went about doing them in the past doesn't really seem, it just doesn't seem efficient. Like, so for the perk test, we charge per hour, but invoiced after. I don't know any other town that does that. I personally would rather have a check before going out, and then if going over that time period, charging more for it afterwards. Right now we're $150 per hour. And so the one perk test that we had this summer, we're still waiting to get paid for it, and we did the work already. So that's the thing that I think we need to change. I guess the price on that typically is something we'd have to think of. Right now, like I said, it's $150 per hour. If a perk test, I'd say in this town, goes more than 2 hours, that's probably unlikely. I would say, anywhere around $150 for the first 3 hours, and then $50 per hour. I also like to think of fees in sort of relation to how much of our time. So if we put a saying, $50 per hour, that's paying for somebody from the health department, Alex, to be out there witnessing. So that's something to think of. The other thing is that we had a flat $350 fee that included both the permit and plan review, but no separation between the two. Whereas sometimes we do need a permit without a plan review. When you're abandoning a system, so you're no longer going to use your septic system, you have to pull a permit. We do not have to review paperwork on that other than making sure that the person that did it is licensed. There's no plan that goes with it. Same thing with for smaller jobs on a septic system. We don't have to review a plan. These are repairs, not new projects. So I propose that we take the plan review fee and separate that from the permit fee. So, but that doesn't, it won't change the fee that we're putting on new systems or repairs, large repair systems. Basically, it'll keep it still exactly the same amount. It's just that we're separating the two portions of it.
How many septics do we have left in East Long Meadow? Because we're on the sewers.
I don't know. The thing is, we only have permits or files for those that we actually know about. If they were made before 1995, the requirements were not the same. So we might have something on file for a house, it might just be a hand drawing, but we might not have anything at all.
Okay.
Yeah.
I'm
There's-
just wondering. Oh, go ahead, Alex.
There are a couple areas in town where sewer cannot do. There's some paper streets that are gonna have septic systems, so there's not a lot, but there are some.
So I'm just wondering just again, trying to reduce the number of things you have to do. What's the purpose of separating those out into 2 fees instead of leaving it as one? That's the only thing I didn't understand.
Because charging someone $350 for a permit when they're just abandoning a system is pretty ridiculous. Like, there's no plan review needed for
we
that.
do not review what they're doing to get rid of it.
All we would do is that the fee would pay for processing, that 150 would pay for processing, and for either Alex or myself to go out to make sure that they did the work that they said they did.
So they have to be like a licensed septic removal team, and thereby then it kind of removes some of the other like liability. I've seen when septic systems
Yeah.
go bad. So,
But
Yeah.
on the other hand, if you look at if you have to get your system replaced or if it's a new system, there's a lot to look at. The plans are much more elaborate. It does take quite some time to go through that
Okay.
aspect.
yeah, that makes
Kind of
sense.
the same as like a new business, we have to make sure that everything has been done. Yeah.
Do we have to vote to make that change, or can we do that change without voting on it?
I think we do need to do a vote and then a posting for that. So if we do that, then we'll have to post before
Okay.
you guys go in.
And I totally understand I sort of trust y'all to figure out what that best dollar value is on the first one that you were talking about. Just the per hour, right? To say all of our inspections, 95% of our inspections take less than 2 hours. So to come up with a flat charge so that you get the funds in hand and then can bill for a smaller portion of that after the fact. Whatever you think that is appropriate for that 95% of that, those inspections that y'all have to do.
Every once in a while, you might get one that'll take the entire day. And we would definitely want to be able to at least bill over a certain amount of it.
Totally understand. We want, the department to be paid for the time that you all spend 100%. But if there's a way that you can say the flat fee up front is whatever that is, $150, $300, and then any particular after the fact, any above X number of hours will be this much, $50 an hour. Please, I think I trust you to put that in, whatever that is appropriate, and then we'll vote on that next time.
Like, I certainly don't feel like we need to go anywhere without getting a guarantee of being paid for that work that we're doing. That just whether it's a food inspection for a new business or septic, we should definitely be paid first.
I think that's really reasonable, and I agree.
Well, then what I can do is kind of we also didn't have an application process really for the perk tests as well. So we can kind of solidify that paperwork and everything like that. And then I'll make sure everybody gets a look at it. And then I don't know, once we do that, maybe we should do I don't know if we should do a vote then.
I think is there so I'm just thinking about, like, because I grew up in Hampton and Wilbraham, they all were on septics. So what did they do for their application process? Maybe if we can kind of get best practices in the local communities, because then we could see what that application process looks like, what they're charging for their fee schedule, because then we can make sure we're at the
Yeah.
same.
Things are very different across the board everywhere. It's like when I worked in Chicopee, everything was just $100, $100. Didn't really matter what you did. Other towns like up to like $500, which I guess I don't know how we justify that here. It's just that would be a lot of, I don't know, for a lot of timing.
So I think one of the things I would suggest we do is maybe look at like the average amount of time it takes you to do it. How much is your time worth in terms of like the amount of hours you're putting in? So we're paying you appropriately. And then actually then we can say, okay, so we looked at the last 10 we've done. And then we said each of these take us 3 hours to do. And our hourly rate, you know, on average is 75, 50, 100, whatever we determine is your like rate. And then we can say, this is our flat fee. You know, sometimes it'll take us an hour, sometimes it'll take us all day, but at least we know on average, this is where we will be. And then if you really do go above and beyond, then you can have those additional hours you charge for.
Yeah. And I mean, like I said, this might be, if we do one more this year, that would be 3 for the entire year. It's not a,
Yeah.
Whereas while we might have three perk tests, there might be more than that for when it comes to the permits, just because of what we're talking about, like abandoning systems and things like that, or just you know, if a system, if a smaller portion of the system that isn't the leach field has to be replaced, then you wouldn't have to have a perk test, but you would have to apply. You would have to fill out a permit. So there's different areas where things might be a little different.
Yeah, I echo Katie. I want you all to be paid for the time without making it inordinately complex for the residents to understand what they are applying for.
I think this will make it much easier and sort of streamline our Title V program in town.
So it sounds like we would love to see a draft at the next meeting that we can discuss. And then again, it sounds like we're on the same timeline that we discuss and then post for a vote in October.
Perfect.
Katie, Rebecca, does that sound right to you?
That sounds great.
Yep, perfect.
All right. Okay, trash and recycling program updates. I know my trash is getting picked up.
Mine just got picked up today, so I'm very happy. Been on a regular schedule.
So early.
So early it wakes me up, and my husband, I gotta put the garbage out the night before now.
I
Not
totally
that
took the
early,
trash out.
but I come home and it's picked up, so I'm happy. No
Yep,
complaints.
Sunday night, I'm out, putting it out.
I know they were, we did send a message out when the weather got really hot. They, you know, they have been coming earlier. Also, I guess the hours when it's really hot, I guess the hours at where they drop off the recycling change as well. Maybe just overheating and things like that.
Would make sense.
Which is why they want to also get to town earlier, besides the fact that it's being hot. But also I think that Republic came later than what we had posted for them to come. They were supposed to be in town at 7 and
So they used to come early, and then they stopped coming early, and they slowly got later and later and later. And then again, it was like, do they come? Are they here? Like, what's happened? And this group has been great. And I will have to say, there's trash not all over the yards or in the driveway. Like, it's literally so clean when they go through my street. It's like a miracle.
They put my bin not in the middle of my driveway so I can get my car in when I get home. Of course, they've come before I leave the house, so I'm like already putting it back in. But like, I commented on that yesterday to my husband, like, the bin is like put up on the corner of the yard, like.
And their our contacts and our communication with them has been really good. And anytime I thought like the communication was dipping, they were receptive to, making changes. So that's really good. Actually, we got an email at the end of the day, which is what we all wanted, just to update on what's going on. And did that mean that we didn't get a single call today for some people have trash myths? That's gotta be like,
Yeah,
that's amazing.
been a couple days.
That is awesome.
I feel like our bar was very low, but we have exceeded our bar for trash pickup in the town of East Long Meadow. That makes me so happy.
Okay, well then I will bring some things that aren't not making you unhappy, but things that are kind of like giving us heartburn. Actually, only one real thing that's giving us heartburn, and that is that we still, the supplier that makes the green plastic for our green overflow bags, we were supposed to get them. They were supposed to be in stock last week, I guess. And now they've added another 5 weeks to that. So October. So we're still going to be using the blue bags with the red drawstring. We are not going to be using the orange sticker that's on them because it is costing us more. I guess they have to open up the rolls and put the stickers on the rolls. So if you go to Ace or you go to Big Y and you get those bags and they don't worry, Casella knows to pick them up. There aren't many blue bags. They're blue bags with a red drawstring are pretty noticeable as being ours. So hopefully we'll get that. And we still, we're still holding off that fee increase till we have actual green town bags. I feel like it's only fair that we take that route. Let's see. So the big thing that's happening right now, and it's, Liz is doing such an amazing job organizing all of it, is so on November 1st, the state's commercial food material disposal ban, the threshold for requiring you to have an organics waste program in place goes from 1 ton to a half a ton, and our schools, at least our larger schools, will be the most affected when we're talking about what we are as a municipality required to do. We already have many businesses that have these plans already in place, but this is just in regards to our town. We've gone through and Liz got us several companies to bid out to be our organics hauler for the schools. We're going to go with Commonwealth Sustainability, and if anybody came to the Earth Day cleanup event, they had a table out there. Actually, they've been very their communication with us has been great, so we're going to be utilizing them. And then we're also getting like cafeteria sorting stations, like you might see in larger businesses, so they'll have like regular solid trash, food waste, recycling, and then the milk cartons are going to be emptied out and put into another container. So tomorrow we're all going to go out to Meadowbrook because that's the first school that's going to be piloted, and we're going to see how it works, seeing as it's the first day of school. We thought actually our food service director, Lori Paul, she thought that would be the best place to start because none of those children have eaten in the cafeteria yet. So this will be the first.
My child is like, what do I do in a cafeteria?
My child is eating in a cafeteria, actually in a college cafeteria. So she'll be the first one scraping the food because she knows exactly what to do.
Yeah, so we think that's a great group because they haven't been trained to do it any other way. So we're starting out there. Hopefully we'll be, throughout the fall working with the rest of the schools. But we also want to, before we start buying a whole ton of stations, really seeing how many stations we need depending on it. So that's another way that we're doing it. There won't be any.
Oh, sorry.
Oh, I'm sorry. No, there won't be any this year. There won't be any fining from what I've been told for places that aren't in compliance, that have changed from this municipally from one step to another. So it's more like this is the year that, if you haven't gotten that program together, you got to get your program together.
Well, I think like at this point, just collecting data, like you said, will be really helpful because then you'll be able to determine is there a way we can actually reduce the waste too, like with actual like programs within the school system and make this like fun for it's like a competition of classrooms or something like that? You know, is there other ways to like think about our waste in general within the schools? You know, I know my kid is like the king of like picking up trash on the side of the road. He's like, look at someone littered. So I'm like thinking about like how we can help them understand why we're doing this and what these are there for, and you know, really educate them about like the importance of this as well too.
We're hoping that we've already reached out to one of the contacts, but there's an environmental club at the high school. So maybe if they need to do some community hours or anything like that, we can get them to even come to the younger schools to help out if that sort of works out. But obviously it's sort of in the infancy stages of those. And I think from what everyone's saying, that the hardest group is the high school students to change their ways. So that might be the one that's going to need the most, like maybe hand holding and things like
We
that.
can also, maybe there's some couching we can do as somebody in higher ed, like we do this in a dining hall. And so for our high school students that are looking at college readiness, like this is a skill they're going to need, you know? So maybe we take lots of routes, right? Like you said, the environmental club. I know when I was in college, like we did something with the dining staff because like as a give back to our dining services staff, right? And then as a readiness for what you're expected to do in the next step in your life, whether that's technical school or college. I think a lot of places are already doing this, right? Even some of our businesses do this. If you think about going to Panera, right? Like you put your bowl in one place and your food in another. So I think, you know, maybe there's lots of ways that we can couch it with those older students. But
And
yeah, I
with
think you guys have great plans.
With the signage that that's getting made up and everything like that, it's going to be, it should be a no-brainer. You have to just not care about the environment, I think, to not to go against the signage. It's also going to benefit like the school and cafeteria employees, because now you're, instead of lugging an entire giant container of wet soggy trash, you've poured out the liquids and you've taken, you know, so you're less of a issue picking up heavy things. So now you're kind of got these smaller waste amounts as you're bringing it out. So I think that'll be a win-win. I know that it's going to probably be new for certain staff, but hopefully we can make it easy on them.
And if the food's good, then the kid should theoretically hopefully eat all of it. Like my kid will have like 3 lunches if given the opportunity.
I think
my kid's stressed about the milk. Like this is the biggest stressor in my house right now, is like, I don't drink the milk. So if we can also address the fact that, like, you know, she doesn't need to take a milk and we don't throw it away at the end of lunch.
And that's, you know, obviously that's not something that locally that we can change, those nutrition requirements. And, you know, the nutrition requirements for certain ages, they don't really go well together. I'm sure my kid has never eaten like a side of vegetable that they've put on a tree.
My kid,
But
is
they
the
have,
kid.
yeah.
My kid will eat it. Like
You're so lucky.
he literally eats all the vegetables. He'll eat scallops. He asked for calamari the other night. I mean, like my kid is going to be an expensive date one day when he grows up. But like,
we're
that
coming
was-
to
You can take my kid out because she will also eat calamari.
Nice.
We looked at the lunch menu. This is our first experience with hot lunch. She was like, steamed broccoli. Excellent. I love that. But not the milk.
Well,
I
I think that's really interesting though. So maybe the other question I had was if we are having second lunch also in Meadowbrook this year too, because that might increase the like ability for children not to like have increased waste too. And I don't know if we're doing that, but just something to look into, thinking about like, they didn't have it last year again, because we weren't in the cafeteria, but how do we make use of like when children need to learn about, if you don't like this food, there's another option, choose this, and then you'll have less to throw away.
Mm-hmm. And I think that's the
That's a
whole year
nuance.
process, right? Is that if we're starting this literally tomorrow, you know, some of it at Meadowbrook, then, you know, and then there's no fines, right, until next year. I think the education takes time, right? And then these kids will bring it forward, and then it will take time, but it will get here. Like culture change is not easy.
Oh, and to clarify, like enforcement money, that's not local public health. this is DEP on like on the end of waste disposal. So we're here to make sure that our businesses that are our business are doing the things that they want. Like we've offered having we had Recycle Works come and give a presentation, but we only had 2 takers, and one of them was the school department. And I kind of wish that we had more people coming to it, because I'm sure that there's going to be more businesses affected. And what it's going to end up being on their end is eventually their haulers are going to be hauling so much that they're going to say that you can't possibly have businesses that are meeting the requirements if you're hauling this much waste. So it's going to eventually trickle back to them. So having those options available, because even though this isn't, while we do license the haulers, we don't license the people who make the waste. We don't license them on that end. We license them to make the food, just not make the waste. So it does fit in naturally to boards of health. Whereas I reached out to all my counterparts in Hampden County and Hampshire County, and I think there was only 3 health departments that are getting themselves involved with the program. We're getting involved because we do this through the recycling dividends program. So if we do certain things, we get money back, which is great. And this year there's some requirements about making things more equitable by putting things in different languages, which we're working on. So the more we do, the more money we get back to fund more recycling events, which is great. Let's see. We also have a new it's called a TerraCycle box. So you can bring your beauty product containers to get recycled at the health department. So at 60 Center Square, you can bring in any brand empty cosmetic, hair care, or skincare packaging. You're just asking not to bring in aerosol or pressurized cans, electronic items, perfume bottles, nail polish. Let's see, nail polish, wooden eyeliner, pencils, any biomedical, biohazardous waste, or partially full or full packaging. So basically, your empty, maybe creams and things like that we'll have. But we do have a list up, I believe it's on our website, what you can bring in. And you would just, 8 to 4 in town hall, come to the health department. We have 2 Fix-It clinics that are scheduled. I think they're still looking for fixers. One's on September 9th and the other's on December 2nd. And there'll be a Heart Springs textile truck coming to the town hall parking lot on October 29th. We'll be in competition again with Long Meadow. And there'll be a scholarship fund for the winner that will go to the East Long Meadow Education Excellence Foundation, which I believe is eLeaf. So that is our trash and recycling update. Is there anything anyone wants to discuss about talk some trash? No.
Nope, that was good and comprehensive, Tammy. Thank you.
Busy.
And starting off on good news, which is always good.
I love good.
And I think communication, right, is just like, I know in our neighborhood, Casella's been here before 7. So just like letting residents know, like, have your trash out the night before, is always a good call. So appreciate the communication too that's come out.
Yeah. Let's see. So COVID update. Well, we've been very steady, our numbers, well, at least our numbers of reported cases. Kind of, it's just the line's been going, staying around 50 cases. So for the last 14-day reporting period, which was August 7th through August 20th, we had 49 cases with 10.5% positivity. 3 of those cases were pediatric, and the average was 51 years of age. And 16 of them were over 65 years of age. We are really trending towards the older community having it, it seems right now, or at least actually going to a provider where they're getting tested. So it's really hard to tell. I know. So we had in our household last month, we used test kits. We did not go get tested. So that's 3 people in one town that didn't get reported. But I think it's a good part of people are getting used to it. People are at least they're taking home tests, you know, and they're taking the appropriate precautions once they've gone through it. I have the way things are lined up. I'm gonna go over the new guidance last. So I'm just gonna go over also that I'm gonna go over our vaccination rates. We've reached 74% fully vaccinated, with 44% having their first booster dose and only 10% having their second booster dose. Our lowest vaccination groups are the 0 to 4 group and the 5 to 11. We have 14 children from the ages eligible from 0 to 4 who've been vaccinated. And that's 0% of town basically, and 571 5 through 11 year olds, and that's 44% of that group. You should be looking for the Omicron specific boosters are going to be coming out in the fall. But the message is that if you haven't been boosted and you're eligible now, get that booster, because it also looks like those of us who might not fit into the category of getting a second booster. So if you're under 50 and you don't have these medical conditions, it looks like everybody at least 12 and up will be eligible for the Omicron specific booster. So come get a vaccine if we offer them while you can. We have actually had two vaccine clinics this summer, one in July and one August at the Council on Aging. The July one was really well received. It was busy from start to end. The August one a little slower, but I think maybe everybody was finishing up their vacations last week. But we still had a good handful of people showing up. Okay, so in August, the CDC put out some new isolation and exposure guidance. We're no longer using the word quarantine. They're not too different from what we're all used to. So, you know, if you're sick and you're positive, you stay home for that full 5 days. Some of the other things that were new under the isolation guidance is that on your day 6, which you might be returning back to work, you still would be wearing a mask for the next 10 days. Well, if you test negative with an antigen test on day 6, and then you test negative on day 8, you can stop wearing your mask after that day for that rest of that period. The guidance, if you've been exposed, so there's no more quarantining. It's if you can wear a mask, you wear a mask for those 10 days, and to test on at least, they're saying now at least day 6 at the state level. There's probably some truth to it, because I feel like I've experienced it recently, and that day 5 was a little iffy, but day 6 definite testing positive.
Well, I tested positive on day 6, and then that's when it was, and I was masked. My kid got it. I wore a mask. I wore an N95 in my home. Practice again, like good hand hygiene. I couldn't like fully gown in my home like I would when I'm at work. So, I mean, it's just recognizing that there's still those chances. It drops dramatically on day 5, 6, but like you still can test positive at that time, especially if you are trying your best to isolate from the other people in your house.
I was a solid day 11, because it was a week and a half after the first exposure, and then like 5 days after the second.
And the other thing too to consider is if additional people get positive, your clock restarts. And that's what people need to understand. So like my kid got it. I then reset the clock on day 6. So if my husband had got it, it could have been on day 12. So I think it's just understanding that every time you have a new positive person, your clock resets for that 6-day window. Because you're continually being exposed by the people you live with.
That's what happened to us. Yeah, that's exactly it. Tammy, quick question for you. Where are you getting your numbers for folks in town? Is that through healthcare testing?
Yeah, any type of lab, any testing that goes to a lab.
Okay.
They're required to report it to the state. And then through the state, that's when everything goes through the Massachusetts Virtual Epidemiological Network. Can't say that too many times. And then that comes to us. And obviously that's only the people that would go to, say, you know, your CVS's or your Walgreens or your doctor's office or the hospital and get an actual test performed that way.
But if you
So-
do a home test, you can report it on the DPH website, and that goes to that as well too. So there's an app on your phone. It's very easy. I used it when I tested positive at home to record my positivity.
Yeah, I don't think too many people are using that are outside of the medical field.
Well, they can. I would encourage them to. I highly encourage them to
Yeah.
as a medical professional.
I think that the big message that we've been seeing about COVID is, being more aware of being able to spread the virus, doing things to take caution if you are in a group that's a little more susceptible, or if you're around, you're going to be around people who are more immune compromised, making sure that they're staying safe. And I think that, we're moving towards a way of living with COVID. It seems like we're now more than 2.5 years in to this whole thing.
And I think, like you said, exactly, it hits the nail on the head, is that people are going to have their own issues. And so if you see someone masking in a public space, don't shame them for doing that, because they may have other medical issues you don't know about, which I saw happen recently. And it really was disturbing in our town at a grocery store.
Oh.
And that's really sad, because someone may have medical issues you don't know about, and they're doing that to protect themselves, or someone at home who can't get vaccinated. Just be kind. That's the big thing I think we have to really kind of take away at this point too, that everyone's in different positions. And the numbers at the hospital, like you said, are reflecting what we're seeing in the community. Our numbers have not dropped below a certain number of admissions, and we still have people in the ICU with COVID. So it's not going away. This is going to be part of our life, but how we can live with it. And I traveled and went on vacation, and how you can be safe. You have to do what's right for your family, but also what's right for you as an individual as well too.
I think
gonna
too,
say-
Katie, like you said, oh, sorry, Rebecca.
No, go ahead. Go ahead.
I was gonna say, right, if you see someone masking in a store, they might be protecting you because they're on that day 6, 7, 8, 9, right? And that's the other piece of it. So just echoing that recognizing everybody's in a different place. Sorry, Rebecca, go ahead.
No, it's okay. So we teach juniors and seniors. We have no less than 40. This week we have our seniors and we have 41, and we have probably about 7 students that come in regularly and they mask up. Springfield is not requiring it, but you can wear them. And they're adolescents, they're teenagers. So they have that mind, where you have cliques and there can be issues, and it's a large group, predominantly girls, and we've had no issue. No kids have commented, said anything. Could be because we are in a medical shop, but they wear it in class. They wear it when we're out doing skills in the lab, and there's no issue. And kids, they go downstairs, they have the lunch, remove it and then put it back on and come back upstairs. And it's just business as usual. And those are 16, 17-year-olds. So it's again, they feel comfortable with, and, of course, many of our students are not vaccinated as well. So I applaud that. Yeah.
I just want to say that what I just gave out was the guidance for the general population. I feel like we could address school and childcare, but a lot of them make their own regulations besides what comes out from the guidance. As far as my conversations with our school department, they will be going with the guidance that has been put out. And really, I think the only real differences with the school age children is that if you've been isolating, you can start the testing to get out of a mask on day 5 as opposed to day 6. It's really one of the biggest differences. And for those people who can't mask, if they've been exposed, they're not, they don't have to stay home for the entire time like we had seen before. So, but I would just suggest that if any parents have questions, that they should contact their schools or their childcare providers, just to make sure that they're staying in compliance with what they're asking.
And just the general guidance, right, still holds true. Like, stay home if you are able, if you are sick, right? If your kid is sick, try, keep them home from school, things like that. Not just for COVID, right? But
Yes.
for everything else, we're going to see a flu season. We're going to see lots of other things. And so general guidance, right? If you have a question about it, probably better to err on the side of caution.
And I think the thing that I'm really reaffirming to people is well, I don't want to test because then I'm going to be out of work. And that is just going to perpetuate this getting worse again. And realistically speaking, if we can nip this in the bud and really kind of focus on population disease management, that's really going to be the way to keep our kids in school, to keep other people at work. And, you know, I think it's really important to reflect the fact that we've gone through a really crazy time and really been to places none of us ever wanted to go to. And I do not want to go there again. So thinking about the lessons we've learned from the last 2.5 years, I think has been really great. And you mentioned those as well, Tammy. So that's important.
So that's COVID in a nutshell. We can move on to other business. And since flu got brought up, we're starting to schedule flu clinics. We're going to be utilizing Big Y again to do the drive-through clinics. There'll be 2 of them in October, so October 4th and October 5th. This year, what we're going to do is we're going to split the locations. So the first day is going to be at the Council on Aging, and the second day is going to be back at the fire station. And we also kind of staggered the times on each days instead of making it a whole 7 to 7, which everybody who staffed it told me that middle of the day was just, it was just people sitting around waiting, basically. So we'll do, the first day with the senior at the senior center, it'll be early morning to early afternoon, and then we'll start early afternoon, early evening up at the fire station. That way it'll kind of keep things, if you have to make a decision, you can choose one or the other. And we're also working with the school departments. We're probably going to use Big Y again to do some clinics. We'll do flu and COVID, since obviously the kids need to be boosted, and not even just boosted, since we still have lower numbers. It would be great to get some more people on board. So hopefully, as time has gone on, people aren't they've sort of warmed up to the idea of the pediatric COVID shot. So I'm hoping we'll get some more takers.
It's very safe. It's been highly studied. Multiple research studies have come out saying how safe it is. So in case people are fearful, speak to your healthcare provider about that, and they can discuss the risks and the benefits for you. It's really important to do that. And also with the flu vaccination as well too.
We brought my son came to the July clinic that we had at the senior center, and he was great. He brought out all the tables and everything like that. And then after that, when I was like, okay, it's time for you to get a shot. Oh, I thought I was just here to help. No. Get your booster.
Yeah, my kids got their boosters last week. Again, we had it in May, so we just got it, wait until the tail end of our immunity, and they all got it and they did great. And my kid was like, it didn't hurt when I got it, but now my arm is sore. I'm like, that means your body's building an immune response, bud. And he's like, okay.
Let's see. So we've had a pretty busy summer going on. We had three whole tables over at National Night Out, representing the health department and the Medical Reserve Corps. A lot of people came by talking about different topics with us. Some of the volunteers that we haven't engaged came by, so it was great to see them all in person. And I know that a lot of people, it was great. Liz was able to talk recycling and trash to some of the residents. Let's see, we're having an event at the Council on Aging in September, because September is Preparedness Month. So we're going to have an event where we talk about personal preparedness, building go kits, and also IT will be there to sign people up on Code Red. It's not the hardest thing to sign up, but I think some people get a little nervous going on a website and trying to do that. And it'll also, if they don't have access, somebody there will be able to help seniors to sign up. We haven't posted that yet, but it's open to everybody, not just seniors. We also we finally posted for the public health nurse position, and we've received several suitable candidates. So hopefully I'll be able to start interviews for that position soon. Oh, and the last thing we already brought up, which is the first thing, which was that the remote participation provision of the state's open meeting law has been extended to March 31st, 2023. And that is the end of our report.
think we did pretty good for not having a meeting in July.
We really put a lot into this 1 hour and 13 minutes, I'll tell you.
Mm.
Productive.
Any new or additional business that anyone wants to discuss tonight?
Did I forget anything, Alex or Renee, that you can think of? It's been
I mean, there's always monkeypox. We need to keep going.
let's wait. Let's hope. Let's have our get a public health nurse in, and then we'll have that discussion.
We do have testing at Bay State. If
Mhm.
anyone is concerned about that, please call your healthcare provider so you can get examined and determine if you need to get testing.
Mhm.
And you know, it is something that's close contact spread. So if anyone calls and has questions, that's the biggest thing to know, that
Mhm.
close contact and how you get it.
Yep. Close contact in this is very different than the 6 feet, 15 minutes that we were
Correct.
very accustomed to. But I know Mass DPH has good information, CDC, and then Fenway Health out of Boston has excellent information as well.
I have been working with the schools and with some childcare providers because they just want to have basic information for, cleaning and things like that. All of that is very straightforward and readily available. But if anybody ever really does need that information, they can always contact the health department and we'll make sure they get it.
I never thought I would see 2 major diseases come out in my time as a healthcare professional.
There's so much else going on right now. I just there's also a drought. Everybody got the message.
Oh yeah, we have to stop the watering, right?
It's recommended. It's
I
not
think
a
every other day or something.
Yeah.
Supposed to get some rain overnight, so.
Yeah.
let's hope so.
Hopefully it's a monsoon. I did drive home in
Well,
tornado warnings the
yeah.
other day and I was like,
Not
My
that
God.
bad, but yeah.
Yeah.
Although they've got flooding for Mississippi, so terrible.
All right. Anything else anyone wants to talk about tonight? All
let's
right.
find
Then
our next date.
I was going to say we need to look at September.
Mm.
Do we want to do back to our 3rd week? We did it this week because of vacations everyone had in August. Do we want to go back to the 3rd Tuesday or do you want to stay on the 4th Tuesday? I can't
Can
do the
we-
4th Tuesday. I lied.
Tuesdays don't work for me either.
Tuesdays don't
so
work for you anywhere. Okay.
No,
Okay.
no. Not at least through December.
Okay. Do you want to go back to Wednesdays then?
Sure.
I can do Wednesdays on the 21st, but then I'm going to have a few Wednesdays where I need to be at work at night. So if we want to do Wednesday the 21st, that's okay for me.
The
But
21st works for me too.
Works for me as well.
Tammy, Alex,
9/21. Oops.
Yeah.
For 6.
6.
Yeah.
Katie, is that
I'm
okay
on
with you? Or do you want to?
I'm on service at the hospital. So whenever so when I say 6 o'clock, you may see me still at the hospital if I get stuck here. But that's fine. I'll make it work.
It's not bad. It's good for me because the schedule for my husband's now on Tuesdays and Thursdays he's back at school. So I'm like, no one's gonna be able to wrangle.
Yeah,
on
and
Thursday.
my Wednesday commitment is only like 3 weeks long, so we should be able to
Yeah.
just,
And Wednesdays
the
really
meetings.
work really well for me too. So I think if we switch back to Wednesday, that's fine.
okay. All right, so Wednesday the 21st at 6.
Perfect.
All right.
Anybody interested in that that training through MAHB, let me know.
Can you just send me the
I
information?
just send it. Yeah.
I don't
just
think
send
it's out yet.
Okay,
When you get
Yeah.
it.
I'll send it.
at least we can look at it.
Thank you for all your hard work, everyone, by the way.
Yeah, Alex, the tobacco
Yeah.
regulation stuff was super helpful to get and have a chance to read ahead of time.
It's a lot of stuff.
Mm-hmm.
Mm.
It's good reading at nighttime, if you're no.
All right. I make a motion to
Everybody.
adjourn.
I second that.
All right, I will vote aye. Katie Dobbins,
Bye.
Rebecca Torsha.
Aye.
All right, everyone, have a wonderful evening, and we will see you next month.
Happy
I'm looking
first
forward to getting some of that stuff
Yeah.
to review ahead of that.
Be well, everybody. Take care.
Bye.
Bye.
Yeah.